When child psychiatrists are seeing kids, they're usually evaluating them for a variety of issues and behaviors that they're presenting for. So particularly around OCD, we want to see if kids are doing repetitive behaviors. Things like perhaps hand washing is a really classic one. And honestly, if you look at their developmental stage, that can also guide you a lot of times. So like younger kids tend to do things that are related to contamination or being concerned about wetting their pants. As they get older, they tend to start to have other kind of concerns that are related to their development, maybe social concerns. But the other thing too is they can look for obsessions, although for some kids it's really hard, particularly if they're young, to know if they're having obsessions. They don't necessarily view them that way. I think psychiatrists should really, look for these things if kids are saying that they're hearing things. Often, particularly young ones can think that they're hearing a voice, but it's actually an obsession. Or if there's a family history of OCD as well. That's something that they should definitely be looking for as part of their overall evaluation. If kids have a change in their functioning at school, sometimes they're doing a lot of ritualization in their head, and so you have to get really specific about asking questions around OCD kind of things because they don't know to call them compulsions or obsessions, but just asking about repetitive things that they have to do to make themselves feel better or less anxious. There are some other things that psychiatrists might look for too that make us think about OCD. So when kids have tic disorders, so whether they're motor or verbal tics, those can often run in kids with OCD. ADHD is often comorbid with OCD as well, so it's just something that you should start to think about more in those kids. So comorbidities can often make us think about, OCD and OC spectrum disorders. Hair pulling disorder, skin picking disorder also are related to OCD. So again, if you're hearing about those things or observing those things, then you should definitely start to ask more about more traditional obsessions and compulsions.